pretty much every chronic disease in kids is skyrocketing. 1 in 13 kids has a severe anaphylactic food allergy. 1 in 13 kids has an autoimmune disease. 1 in 10 kids has ADHD. Those are really, really crazy rates that we see.
What do you think is the main driver behind this massive increase in chronic illnesses that you're seeing in kids right now?
A lot of it is environmental. And now there's chemicals everywhere. Chemicals in our food, chemicals in the air, chemicals in the toys that kids are playing with. A lot of them are called endocrine disruptors, which affect our hormones, which affect metabolism. So that's a huge reason in terms of the obesity rates. And the other thing in that the toxins affect is our microbiome in our gut. Kids aren't moving as well. Kids aren't getting enough sleep. And they're just exposed to so many toxins that people aren't necessarily aware of. There's so much research now going on into the human microbiome and how it's related to health and how it's related to chronic disease. And we can actually test the microbiome now and see the different bacterial makeups of children's guts and know that if we did absolutely nothing and we left it, then their risk of getting a certain, whether it's eczema, asthma, allergies, could be really high. So trying to just educate parents more on how do we reduce those toxins in the environment, because that's a huge piece of it.
All right. Excited to have you here today, Dr. Kiera Smialek. I pronounced that correctly,
you did,
right?
Yeah.
All right. Naturopathic doctor, working primarily in pediatrics.
Mm-hmm.
Awesome.
Yes. Yeah.
Super excited to have you here. We've had some conversations on the phone. First time we've met face to face, but I reached out to you because I'm just so interested in pediatrics, the naturopathic kind of way of dealing with children. So just excited to go through all sorts of stuff with you today. But would love to first just kind of open it up to you, and I'd love to learn a little bit about you. Maybe tell us about yourself, your practice, what got you into what you're doing today, and we'll go from there.
Sure. Well, I'm very excited to be here. Thank you so much for having me. I love doing these types of things. So I am a naturopathic pediatrician. I have been in practice for about 16 years now. And, when I was back really in college, I had decided I wanted to become a doctor, wanted to go to medical school, and I was going down the traditional route. But I was actually dealing with health issues myself. So I would get sick very often, and I felt like I would go to the doctor and they just wouldn't listen to me. And they would just give me a prescription for antibiotics, and it just didn't feel right. It felt like this cannot be what medicine and healthcare is. And so someone had actually mentioned naturopathic medicine to me, and I was not familiar with it. But when I researched in the whole philosophy of trying to get to the root cause and not just treating the symptoms, but really treating the whole person and educating and really developing relationships with your patients, that to me was what healthcare is. And so that's kind of what led me to naturopathic medical school. And then the pediatrics portion actually came while I was in medical school and kind of towards the end. I am the oldest of 4 children. So I've always kind of been a caretaker, nurturer. That's just my personality. And so I'd always loved working with kids. And honestly, I realized when I was doing my rotations that working with children was actually my favorite part. It was so fun, and we made such a difference in their lives, which then made such a difference in the parents' lives as well. So then I decided to kind of really pursue pediatrics. And then I decided in 2016, to go out. I was in a 2 different group practices for a little while initially after medical school, but then I decided I wanted to really build something and really build a pediatric center where it was really focused on natural medicine, because the need here in the Valley is so high. Parents are looking for other options, and we didn't have that. And I actually was met with a lot of, a little bit of resistance in saying that, well, you're a naturopathic doctor, you have to do everything. You do family medicine. And I'm like, no, I don't. I actually really love pediatrics. And so I was really persistent, decided this is what I'm going to do because I had the vision of what it is. And I've been able to really build that and grow that. And we have a really great clinic up in Scottsdale now that we see children from birth all the way through teenagers. And we do wellness exams. We'll do obviously the regular sick visits, but we see a lot of kids with chronic disease too. And we help them with those.
So yeah, you brought up an interesting point. So we've got a great pediatrician. She's not a naturopathic pediatrician, but what would you say is the main difference between naturopathic pediatrics and a traditional pediatrician?
Yeah, that's a great question. So the one of the biggest differences is in how we look at healing and health in general. So we do a lot of prevention in pediatrics. And by the nature of us being naturopathic doctors, we are able to spend a lot more time with our patients. So instead of the quick 10-minute visit that you have, we spend 30 to 45 minutes sometimes with our patients, really going through all of their developmental milestones, really making sure parents are asking the questions and they're getting the answers they need, talking about their diet and nutrition, and talking about their gut health, and talking about their sleep, all the factors that are really, really important in keeping a child healthy. And then when it comes to illnesses or needing to address some sort of concern, we're looking at, okay, well, let's find what's the cause. Why is this going on, as opposed to just treating the symptom? And then sometimes, we have to use a medication, and we can prescribe a medication if we need to, but we have so many other tools to do, whether it's diet and nutrition, whether it's lifestyle changes, whether it might be certain supplements that we talk about. But we have a lot of different options before we go straight to doing like a medication.
So that's awesome. I actually really like that. We do a lot of that same stuff in our practice, as far as trying to be more preventative than reactive, and just trying to, someone comes in with a symptom and you're trying to fix that one symptom, but really trying to get way ahead of it and say, hey, like, how can we help you prevent even getting to this point? So I absolutely love that part of it. You mentioned that earlier that you just really loved working with kids. I'm just curious, like, what's your favorite thing about working with kids versus adults?
So honestly, I see a lot of parents when they've just had their baby. So I see a lot of newborns. And my favorite part is they are coming in as these tiny little babies, and then usually literally within a year, they're walking into my office, and just being able to see them grow and develop and then interact with me. So many of the kids want to come and sit on my lap, or they want me to hold them. And it's just the kids are they're just so open and free and lighthearted, and they just make it fun, even when they're having a tantrum, which happens, but it just makes my job more meaningful because they're happy, and then the parents in turn are happy as well.
Yeah. No, that's awesome. Yeah. I've got 5 kids of my own. So we've been through all sorts of stuff with our kids, and I can't tell you how much I appreciate good pediatricians and those that genuinely show a lot of love for my kids. You can tell, like, when they go in there, that they just, as what you said, they love seeing them grow, and they love being kind of part of that the first, into their teenage years, just kind of being a part of our family and watching them grow and develop. So for me, like, I know for me and my wife, I speak for both of us, we're just super grateful for good pediatricians. So I've got a ton of questions, and we can honestly just take this wherever it makes sense to go. But, the main audience here, I think, is parents, just looking for ways that they can really try to optimize their kids' health. I've heard pediatric biohacking now, where it's like, okay, what are some things that we can do to help my kid not fall into these chronic illness categories that are growing rapidly? And so I would love to just hit on any and all topics that you think might be interesting. You see probably a ton of patients. And so, things that you've learned, or some of the main things that you see going on right now, maybe some of the main reasons people come to see you, and what you're doing about it would be awesome to talk about. So, one of the things that kind of pops up in my mind, and we can just maybe start here, is a common question people have as their kids are getting their well checks and all that, is my child growing at the rate they're supposed to be growing? I have, some of my kids, they get growth spurts, and the other ones, they feel super short. And I'm like, do I need to get them checked or whatever? But I'm just curious, what are the things that you do to help parents understand that their child is developing physically at the right pace?
Yeah. So during wellness exams, we're always assessing growth and development. And so when we're doing growth, we're looking at growth on what we call growth charts, and they're looking at percentiles. Now, every kid grows at a different rate. And so you have to take into account that individuality of that child. And really, we're looking for the consistency. So there could be a child where their weight is on the 10th percentile, which is low, But every time we do their well check and we get their weight, they're still at the 10th percentile. So their growth is appropriate because they're maintaining that. We get more concerned if their growth starts to fall, basically decrease. So if they were at 50th and then they're at 30th and then they're at 10th, then we have to look at, okay, well, why is that happening? Something is going on. Is it a diet thing? Do we need to do some labs to assess that further? And the same goes with height too. So there are some kids that are really tall. There are some kids that aren't, but as long as they're consistent on their growth charts, then generally we just reassure parents and we'll show parents like, this is their chart. Look, they're growing just fine. But the other piece of that is we're talking a lot about what are they eating? Like we will sit down and go through what are they eating for breakfast, lunch, and dinner? What are they eating for their snacks? What are they drinking throughout the day? How much water are they drinking? What is their sleep like? Because all of those factors play a really big role in growth and development. And sometimes we can identify, oh, well, your child's not getting a lot of nutrition, so this could be a reason. And so let's address it, doing these types of things. Or sleep is huge. There are so many kids that are not getting enough sleep, and that is directly associated with growth and development.
Yeah, I actually came across a kind of staggering statistic. It says that about 34% of children and adolescents experience sleep disturbances, which is more than double what it was in the 90s. So I think sleep patterns are getting disrupted massively right now. What do you think is the main driver behind kids and their sleep patterns being disrupted?
Yeah, I mean, there's quite a few. It could be a few factors. One of the big ones, though, are going to be screens. Screen time. We know screens actually have a true detrimental effect on children's development. We know that screens actually decrease melatonin synthesis because the blue light actually decreases the ability to make melatonin, which is what we need in order to go to sleep. And a lot of kids, they'll wind down at the end of the night and they'll watch a show or watch a movie, and that actually can interfere with their sleep because they're not able to produce melatonin effectively. Other kids, kids are now so involved in activities. And so they're, especially older kiddos, so they're busy and then they don't get home till 9 o'clock at night. Then they have homework, they have to eat dinner. But the time they're going to bed, it's way later, way past that ideal window. And then they have to get up early for school. So the amount of time, and that's affecting their circadian rhythms. And then which in turn is going to affect their overall sleep as well.
Yeah. So the screen time, that one's tough. I guess it feels like the screen time's gone way up. Kids are watching a lot of stuff. You got sometimes for parents, it's an easy way to get them just to like stay busy. Sure. But the average screen time today for kids that are under 12 is somewhere in like that 4 to 6 hours per day. That's the average. Crazy. Teenagers, it's up closer to 9 hours a day. Back, I'm an 80s child and we just had TV. I'd maybe try to like sneak and watch MTV so I could see like a Michael Jackson, music video back when it was just music videos, but we didn't sit around and watch TV that much. I mean, we would watch movies on occasion, but, you kind of get sick of watching commercials. And so you just like go outside and play. So what advice would you have for parents that are struggling with their kids' screen time? Because I'm finding that some kids, you take it away and they freak out, almost like it's a drug. So what advice do you have for parents that have kids that are highly addicted to screens?
So some of it depends. I mean, if you have younger kids, it's better to start now by creating really good habits. So being really in control of limiting the amount of screen time. So the American Academy of Pediatrics actually recommends for kids under 18 months, they should have 0 screen time, and kids 2 to 5 should have no more than 1 hour a day, which is a lot of kids have way more than that. But I try to teach parents from the very beginning, try to limit it as much as possible because it just gets into a downward spiral and it gets harder and harder as they're older. But it could be setting limits or making things like, okay, there's no screens when we eat. There's no screens at mealtime. There's no screens in your bedroom. You have to set some ground rules and really stick to those. Sometimes it could be, is it something, if you're going to watch something, could it be something that you're watching together? So you're not just allowing the child to just have free reign of whatever they're wanting to watch, but maybe you're watching a movie together so that you're at least with them and they're not isolated. Because we know the social aspect of screen time in children is really significant as well. So it is a very tricky thing to do, but I've had parents that have had to take, like, they just hid the iPads and they really have, and they, do as much as they can, but it is difficult. There's And we live in a world of screens. So it is impossible to fully avoid it. That's just the nature of the world we live in. But you can also look at, for younger kids too, what about doing more educational things? So not things that are very highly stimulative, that have lots of sounds, lots of lights, lots going on, but things that are more educational, slower. So kids are maybe learning from the 30 minutes that they're getting, as opposed to them just zoning out.
So if you're trying to get a kid to go to bed, how many hours before bedtime should they avoid any screens?
Ideally 1 to 2, ideally, to really not affect that melatonin synthesis.
Yeah. Speaking of melatonin, do you have an opinion on melatonin use in children?
So most of the research, actually, there's been a lot of research, especially in kids with neurodevelopmental disorders and sleep issues associated with that. So like kids on the spectrum that have trouble sleeping, there's a lot of good research that melatonin actually benefits them, because a lot of those kiddos actually don't make good melatonin. So they actually need that. So there isn't a lot of research that supports that melatonin is actually bad in kids, but the dosing makes a difference. And this is where I think where people kind of get confused, in that usually the dose you need is very, very small. The higher doses of melatonin, so melatonin is actually an antioxidant. So at higher doses, it's actually used in cancer care as an antioxidant, but we wouldn't use it. We don't need to use it in really high doses in children. We're talking like little, maybe 0.5 milligram, 1 milligram at a time. We don't need to go really big doses.
Yeah, I think that's with medication in general. Like if you can use, you only use it if you absolutely need to use medication, but when you do, use the least amount possible. But I found that to be true with melatonin in my kids. They get sleep disruption. We travel, summertime's coming up. You're all over the map. They don't have a normal schedule. And it's like when you try to get back on a schedule, it has been a great tool to help them, like, okay, you've been going to bed at 11 o'clock every night with your cousins. We need to get back to the normal routine because you got to get up early. Right. But I found that, like, even the kids' melatonin, they'll sell them in like 5 milligrams and whatever. And you could give a kid a 5 milligram and they're going to fall asleep. You could get a 1 milligram, break it in half, and they'll fall asleep almost just as fast. So I think that was a big learning for me. It's like, they don't need that. Like they need like micro doses and it hits them pretty solid if you need to use it. But I know there's been some opinions about the use of melatonin primarily around any hormone disruption that could occur by using that. Is that a myth, or is
there's not a lot of research to support that. But the idea is using it as needed, kind of like you said. So definitely traveling time zones. Melatonin is great when you're traveling to different time zones because it's going to help your body to adapt to the new time zone. But the idea is using it occasionally, unless you're under the supervision of a physician and your child has something else going on where they actually need that. And sometimes there are kids that actually have genetic conditions or issues with their genes where they don't make melatonin. And so they would benefit from a daily time. But for a regular kid, they don't need it all the time typically. Yeah.
So you had previously mentioned too, like circadian rhythm getting messed up in kids that have late schedules for sports and other things. Is there any like guidance around that? Because I know I've got 3 kids that are in competitive soccer, and I have a daughter that's in competitive dance. And at any night of the week, they might be getting home past 9 p.m. from running for an hour and a half to 2 hours. So, I know that if I went to the gym and worked out at 7 p.m., I probably wouldn't be able to go to sleep until midnight because I'd be like energized, right? Yeah. So, I mean, what would you like, how do we as parents navigate that? Like, we can't control their soccer schedule or their sports schedules, and they're getting back late. And then they probably are pounding some unhealthy quick dinner because they're starving. Right. But is there anything we can do? Like, if that schedule is that way and we can't control that schedule or their school schedule the next morning, is there anything we can do to try to mitigate the sleep disruption that might come from that?
So one of the big things you could work on doing is really setting a good like sleep routine. So have kind of a routine for like when you get home. Ideally, if they're eating, make sure it's protein rich so that they're getting protein, not doing high sugar, which is then going to affect their blood sugar. And then having kind of like a wind down routine, whether it is like really no screens, light, very low lighting, whether they're going to kind of read or do something that's relaxing to them to just kind of get their body and their mind to wind down. It's tricky because of the world that we live in now. Like it didn't used to ever be like that, but now it's just, that's the world that we live in. So you have to do the best that you can with ideally trying to get them to be able to go to sleep as soon as they are able so that they're able to get enough sleep. Because that's the tricky part, is getting that.
And what about kids that are so deep in sleep that they don't wake up and they wet the bed deep into like they could be 10, 11, 12, older even. Do you see much of that in your practice? And what do you see causing kids that some kids just wake up naturally and it's very easy for them to, even if they're crazy tired, they still get up, their body wakes them up, they go to the bathroom. But other kids that just cannot wake up and they don't, they're in such a deep sleep. Like what is causing that? Why is it different for some versus others? And, do you see that in your practice and how do you handle that?
Yeah, so we do see some of those cases. So interestingly enough, those kiddos who are bedwetting past an age that is appropriate, a lot of times I'm actually referring them to an airway specialist, because a lot of times there's actually some sort of disordered breathing pattern that's happening at night, which is affecting them, which then sometimes we also see, well, those kiddos might have behavioral issues or focus issues during the day, or do they grind their teeth? Do they snore at night? Like all of those could be airway focused issues that could be improved. And a lot of times that is the underlying. So I refer them out to someone else that really specializes in that to really assess their full airway to see, is there something going on that really could be addressed and could really improve that.
Is there an age that you would say is that appropriate age where they should be waking up? You said the appropriate age.
Yeah, I mean, most kids are nighttime potty trained by 4 or 5, like most kids, but they will say, oh, kids, especially if the parent wet the bed till they were really late. Oh, that's okay. It's just genetic. But usually there's actually could be an underlying reason why that's happening.
That's interesting. So I've asked this question to quite a few different people. And sometimes it could be gut health related. It could be, kind of what you mentioned before. If you have someone that gets really worked up, like if you have a kid that gets really worked up, kind of anxiety ridden, and they don't really calm down very well, that they tend to be the ones that fall deepest into the sleep and then they don't wake up. And so like I've had other people advise like, hey, like that parent should do everything they can to calm them going into that sleep, like making sure like no screens, kind of that routine, low light, relaxing, that helps that kind of individual. But I had someone else on the podcast, an orthodontist, that this came up somehow. And that was, he said, his number one thing that he refers out is to an ENT for kids that struggle with sleep, generally because it's an airway restriction or something like that, which can lead to bedwetting. And I never put that together. So that's really interesting. Anything else that you would advise to help kids get better sleep? Obviously sleep's so important.
I mean, sometimes we actually talk about, sometimes kids need a little bit, sometimes we'll talk about supplementation, like sometimes like magnesium. So magnesium glycinate, which is really calming and can really help with sleep at night. So there are some different herbs sometimes that we use that are just, again, calming and just help relaxation, just help a child to just calm down after a high level of activity. And sometimes we need to use some of those. And those types of things are very safe to use on a regular basis. So it's not like melatonin that you don't want to use it all the time, but you can use magnesium, and there are certain herbs. There also are certain neurotransmitters that you can actually use really safely in kids that just help calming, especially if that child tends to be a little bit more kind of anxious or on edge.
Yeah. So trying to keep some sort of a routine, something calming, low screens, potential magnesium supplementation, high protein, low sugar, diet before bed. Anything else? Did I get most of those?
I think that sounds like a good plan. Yeah.
All right. I like that plan. Okay. Maybe shift gears a little bit. A big question that comes up a lot with parents has to do with vaccines. I know that vaccines can seem controversial at times. They shouldn't be controversial. They've done so much good, but in the last few years, obviously it's popped up. And I think the big issue is that there's just so many now.
Sure.
Like I don't know how many there were when I was a little kid. But I don't think that there was more than a handful that I was given as a kid. And now there's like this whole menu of like, as a
Yes.
parent, I've gone in and they're just like, well, do you want to do this one, this one, this one? I'm like, can you please explain to me like why
Right.
she needs this one or he needs this one? And so a big question that parents are getting is like, what vaccines does my child actually need?
Hmm.
Like, and then which ones should be more on the optional, and how do you like even know?
Sure.
I have a niece who has just gone into remission from
Mhm.
neuroblastoma,
Okay.
and coming out of it, uh, they were like lining her up
Mm.
for tons of vaccines, and I get that that's way different for an immunocompromised child versus maybe just someone that is not immunocompromised. But how do you help parents, you know, navigate the vaccine schedule?
Uh-huh. Yeah, great question. So, and I get this question all the time, honestly. This is one of the biggest reasons another big reason that parents come to our office is because they just want to have a conversation about
Mhm.
vaccinations. And unfortunately, a lot of conventional pediatricians just won't do that. And so they want to make the best decision for their child and they just need a little guidance. And so, but you're right, there are so many more vaccines. So if a child was to do the traditional CDC schedule, there are about 54 to 56 vaccines between 0 to 18 years old, which is a lot.
Hmm.
And 18 of those. So there are a variety of vaccines, but there's multiple doses. So in the first year, a child could get 18 doses of vaccines, which is crazy because we're thinking, okay, they're really little, they have an immature immune system. And so is that necessary? Like that's the question that we get. And so the way that we look at vaccines is we're really assessing risk factors. And so when a family comes in, we're looking at, okay, how was the pregnancy? How was the birth? How was the child, depending on what age they are, how was the child's early life? What is the parents' lifestyle? What do they do? Is the child going to daycare? Is the child in school? Does the family travel a lot? Do they do international travel? What are the parents' occupations? Where do they live? Like what area are they living in? And the reason that we're looking at that is because we're trying to assess, number one, what are they going to be most exposed to? And we look at family history too. So if there's a strong family history of maybe someone had a reaction to a vaccine in the family, or there's a high level of autoimmune disease or severe mental health illness, then sometimes we know there could be correlations with certain vaccines and those. And so we'd want to talk about how we do the scheduling. And so once we're assessing risk factors, we're then looking at, okay, well, what is your child likely to be exposed to? And then we talk through that because there are some on the schedule that based on, the family's not going internationally, they don't travel very much, the child is at home. So maybe the child's not going to be exposed to that in the first year of life. So we talk about how do we change the schedule? So a lot of it is adjusting the schedule. Now, of course, there are some parents that choose not to vaccinate. And so, we honor whatever parent's decision is. And our goal is to just make them feel that their decision was an educated decision and really empower them to make that educated decision. And so we're really just helping them to identify like, here, this is what your child could potentially be at risk for. And then we talk about, here's how severe the disease is. Because now we do have some vaccines on the schedule where there isn't a high risk of death from the actual disease. We know that vaccines have a very good place in our healthcare system, and they have prevented a lot of deaths and a lot of disease over the years. But there are some vaccines now on the schedule where the risk of death is very low. For instance, the rotavirus vaccine. So that's a really common GI illness, vomiting, diarrhea. Most kids have it by the time they're age 2. But in the United States, children don't die from rotavirus illness because worst case scenario, if your child's getting dehydrated, you go to the hospital, they get IV fluids, maybe some medication to help the vomiting slow down, but they recover just fine. And so whereas something like, pertussis could be more serious for a very young infant, or bacterial meningitis that could be caused by Haemophilus or strep pneumoniae, which those are two other vaccines, those could be really serious and could cause death. So we're kind of talking about all of those different risk factors to really assess, okay, this is how severe it could be. This is how likely your child is to be exposed to it. And then from there, they're able to make that decision because they actually understand, okay, well, I know my child's not going to be exposed to hepatitis B because it's a sexually transmitted disease right now. So I probably don't have to give my newborn that vaccine, but I could consider it maybe when they're at risk, which is closer to teenage years maybe. And same with polio. Okay, I'm not traveling internationally. I know the likelihood of catching polio in the United States is really, really low. So maybe I won't do that right when they're 2 months old. Maybe I'll wait until they're a little older before we're planning international travel. So a lot of it is actually adjusting the scheduling. And I think that's, in my opinion, that's where a lot of it you can still, if you want to vaccinate, you can still vaccinate and protect your child, but also in a way that is healthy for their immune system and allowing their immune system to develop, especially in that first year of life too.
Yeah, I have a lot of concerns. I just with the sheer number, and when you go in with a newborn and they've got like a whole list of them, and I'm like, okay, is like, what is this going to do to my kid's immune system if you do this all at the same time? Right. So I agree. I think one of the best things we can do is not look at all of them and just be like, hey, none of these are appropriate, but maybe they are, but the timing's got to make sense too. And so I love that you're talking about the scheduling. I'm curious if you have seen, and maybe this is just anecdotal, but have you seen any material difference in unvaccinated kids versus those that are vaccinated, that go through the traditional vaccine schedules versus those with parents that say, actually, like, we're not going to vaccinate our kids? Do you see any material difference in those health outcomes?
It depends. So there are a lot of other providers who have, out there that have either not done vaccines in their practice or have done delayed schedules for a while, and they have seen a difference. I will say a majority of our patients in the practice, most of them do delayed schedules or choose to not vaccinate. We have a generally pretty healthy population. However, is that because we're helping parents to keep their kids healthy from the very beginning, not just related to vaccines, but talking about the importance of breastfeeding, the importance of the food that you're feeding, trying to reduce toxins and chemicals in their environment. So I think I think there's multiple different reasons why, our kiddos are healthy. I don't think it's just the vaccinations. I think there's a lot more to it. If you could choose to not vaccinate your child, but if you're feeding them a bunch of processed foods and they're watching screens all day long, they're not going to be healthier. They're still going to get sick just as much. Yeah.
Yeah. The vaccine thing, I just look at it and I think, okay, well, let's say there were a handful back in the 80s and now there's 54, you said. And the big glaring thing for me is, have kids gotten healthier over time? And they just haven't. No. And it's getting so much worse, and just chronic illness in kids is way up. Obesity rates in kids, they start the obesity charts at age 2, which is shocking to me, but obesity is through the roof. And I think a lot of that just goes to, we can get into that, but I look at the vaccine schedules and I think, okay, all of this is meant to help us like be healthier, live longer, avoid spreading things that are gonna hurt people and potentially death, like you said. But sometimes I just wonder if we're just throwing so much stuff at kids into their bodies that, it's not allowing their own immune systems to take shape as they naturally would, And some vaccines were invented and have like helped countless people with some really nasty sicknesses and illnesses and diseases. But I think the big question is, which ones are absolutely necessary? Because if I'm not like anti-vaccine or pro-vaccine, I'm just like, I'm pro, I want my kid to be healthy. Like, which ones do I need to do? And how do I know which ones are absolutely essential and which ones are protecting my kid from something that's incredibly low risk? So like, what questions should parents ask their pediatrician at that time? So if you've got a newborn to going up to their 12-year wellness check, that's pretty much when most of these are getting hit. What questions should they be asking to figure that out?
Yeah. So, and I wanted to touch too on the point about kids are a lot sicker now, but I think in vaccines, we don't, again, like I said, there's multiple reasons why that's happening. A huge part of it is the environment and the environmental toxins and that kids are exposed to now in our foods, in our air. So I think that's a huge part of the numbers of sick kids that we are seeing now. And I always tell parents too, when we're talking about vaccines, because parents will come in and be like, okay, well, I feel like I have to do the vaccines because that's going to keep my kid healthy. I'm like, no. That's not how that works. You do a vaccine to prevent against that particular disease. Getting a vaccine doesn't make your child healthier. It just prevents them from getting that particular disease. And so it's kind of changing the narrative, because I think for so long people thought, well, we get vaccines to keep us healthy. But not really. We have to do all of the other things to keep us healthy. And then we choose the vaccines that maybe are could cause more severe complications. And then we decide, okay, do we want to give our child that particular one? And so the questions that I would recommend parents asking is, one of them is just asking the provider, can you tell me a little bit more about this vaccine? Is my child at risk for being exposed to this vaccine? How would they get exposed to this vaccine? I will tell you, unfortunately, not all providers will answer that question. And a lot of them will say, yes, you're going to get exposed to it. Your kid can die from it. But I have honestly had parents, and these are parents that have ended up coming to our practice because they went into the doctor and they just wanted to ask, they just wanted to have a conversation. They wanted to say, hey, could you just tell me a bit more about this vaccine? I really want to understand it. And they're like, they just give them the CDC and they're like, it's recommended here, you should do it. And then the parent or parents would ask, okay, what about the ingredients? Or they said, this one has aluminum in it, right? And they're like, no, there's no aluminum, but there is aluminum. Sometimes I have parents that know more than the provider when they go into the visit, because a lot of parents take it very seriously and they actually do a lot of research and a lot of reading because they want to make the best decision. And most of the parents in our practice, it is not a light decision. They have thought through this hours and hours and hours. And so they are really discouraged when they go to another pediatrician and they're just totally shot down and they can't even have a conversation about it. And that's the unfortunate thing. I wish that could change. I really wish that parents could go to any pediatrician and just have a conversation and say, okay, look, is my kid going to be exposed to this right now? If not, could we just do it a little bit later? Maybe when my child's a little bit older, and just being able to have a real conversation about that, because most parents aren't actually fully against vaccines. They just want to do what's best for their kids. Right. And that might mean like just slowing it down and doing one at a time and just having the ability to be able to do that, or really just have a conversation. I feel like that would calm a lot of parents' anxiety too, because then they feel pressured that they have to do it and they're not getting any information. And then they're like, okay, well, there must be something bad that I'm missing if they don't want to tell me about it. It just gets this whole kind of just negative aspect about the whole idea with vaccines. And there's good and bad to both of it. But I think it gets, unfortunately, they don't get the support that they need in the conventional. No, that's world.
Really good. I think as a parent, if you're not getting the answers that you're asking questions and you're not getting, answers back to those, and they're just referring to whatever the standard CDC like jargon is, probably time to get a second opinion, right? Just go ask somebody else, go to a naturopathic, go to someone else, another pediatrician, just keep investigating. There's not a ton of resources out there like to look stuff up. I think AI is helping a bit too, because then you can dig into like actual studies and research behind some of these. And that's what I ended up doing with my brother-in-law, who was trying to figure out, do I need to give my daughter this vaccine and this vaccine and this vaccine? And I'm like, I don't even know what the heck that is, but let's research it. Let's figure it out. And then I can't give a qualified answer, but I can say, ask them about this, and this, and can these two be spread out? And do they have to be taken together? Are there risks of taking these together? Parents just have to ask all the questions. Anyway, I feel like that was the only way. That's kind of how I started as a young parent, trying to navigate this myself, because I was being asked about vaccines that I didn't know what they were. And I'm not one to just be like, for sure. I'm like a trust but verify person. And so specifically it was the HPV one in my newborn daughter. Right? Is that the
hepatitis B maybe? In
the sexually transmitted one?
Yep. Hepatitis B in newborn.
Yes. Yeah. And so I am asking about it. I'm like, well, why would she need that? Well, and then I find out that it's for sexually transmitted diseases, but they said that if I give it to my daughter earlier, it could be more effective later in life than giving it to her later. And I'm just like, oh yeah. I'll take my chances on this one.
Yeah.
Let's not do that one.
Yeah.
But it took me asking like several questions and researching something that I knew nothing about to try to make the most informed decision I could as a parent. Because like what you said, at the end of the day, like you're injecting something into this human that means more to you than anything, right? So as a parent, you're just going to be highly protective of that. So that's why I'm like, I hate that the vaccine thing is so controversial, because it's really just parents trying to do what's best for their kids.
Right. Exactly.
And they just don't know what's right and what's not right, and what's necessary and what's not necessary. And so I appreciate you laying that out for us and helping parents navigate that a little bit, because it's a difficult thing that every parent is navigating right now, especially when the decisions went from, oh, I need to investigate 5 to now I have to investigate 54 and try to be good at that. Yeah. Like parents have to rely on professionals like you. They need people to talk to about these things. So anyway, I appreciate you.
And there are a couple books I usually recommend to my patients that are just helpful in just the general idea of vaccinations. One of them is called The Vaccine Book by Dr. Sears. And he's a really well-known pediatrician that his book it has been around for quite a long time, but it gives you a general just understanding of that. And then there's another one called The Vaccine Friendly Plan, which is written by Dr. Paul Thomas, who it's interesting though. So he wrote this book a while ago, and when he was in practice, he did delayed schedules for a lot of his patients. He had very low autism rates for patients. But now he actually doesn't recommend a lot of vaccines at all. So he's actually changed his kind of idea on it. But I love his book from the perspective of it gives you the whole picture of understanding all the different aspects, not just vaccines, the importance of our environment, the importance of the food that we, are feeding our kids. How do we, if we want to adjust the schedule, how do we do that? So for parents that don't have access to someone that has more education on vaccinations and can't have that conversation, those are at least 2 guides to kind of help start, just to navigate that a little bit easier. And then ask your provider and see if they'll be willing to just have a conversation with you.
Yeah, no, that's great. That's excellent. And I appreciate that. Yeah. I'm curious, maybe shift gears a little bit. What would you say are maybe like the top 3 like chronic illnesses that you're seeing in kids right now? I know there's lots that are kind of like popping up, but if there were maybe a couple, it doesn't have to be 3, but if there are a couple of like the top chronic illnesses that you're seeing in kids and that are growing, that aren't, it's not getting better. You're seeing more and more of these. What are you seeing?
Gosh, I mean, it's hard to limit it because pretty much every chronic disease in kids is just skyrocketing. So we know like 1 in 13 kids has a severe anaphylactic food allergy. 1 in 13 kids has an autoimmune disease. 1 in 10 kids has ADHD. 1 in 31 have autism. So those, 1 in 5 have eczema. Those are really, really crazy rates that we see.
Wow.
Yeah.
So, okay. So we could dive into
there's
every
a
single
lot.
one of those. What do you think is the main driver behind this massive increase in chronic illness across all those? Could those all be related to similar factors?
I mean, in a way, they're all related. And a lot of that comes down to, like I mentioned before, like a lot of it is environmental. A lot of it is the environmental toxins that our kids are now exposed to that we weren't exposed to when we were kids. There were not as many chemicals around. And now there's chemicals everywhere. Chemicals in our food, chemicals in the air, chemicals in the toys that kids are playing with. And all of those chemicals a lot of them are called endocrine disruptors, which affect our hormones, which affect metabolism. So that's a huge reason in terms of the obesity rates. And the other thing in that the toxins affect is our microbiome in our gut. And so we know there's so much research now going on into the human microbiome and how it's related to health and how it's related to chronic disease. And we can actually test the microbiome now and see the different bacterial makeups of children's guts and know that if we did absolutely nothing and we left it, then their risk of getting a certain, whether it's eczema, asthma, allergies, could be really high. And that's even in infancy. And so those are the main kind of reasons that it's the food that we're eating. It's kids aren't moving as well. Kids aren't getting enough sleep. And they're just exposed to so many toxins that people aren't necessarily aware of. The food dye, for instance, like people didn't realize that that was so bad. And now we know that it's so bad for children. And some kids are really, really sensitive to it, and it really affects their behavior. So trying to just educate parents more on how do we reduce those toxins in the environment, because that's a huge piece of it.
So like with skin issues for kids, you mentioned eczema, it could be acne. Do you think most of those have to do with like in the gut, something that's in the gut?
Yep, pretty much. And the way that we can look at that is when we do like gut health testing, we can actually see disruptions in the microbiome, and we can see that. And when we address that, when we address the inflammation in the gut, sometimes we have to address food intolerances, we have to heal the gut, and then the skin gets better. So that's the other thing too. And this is a huge difference in the conventional treatment of eczema versus a more naturopathic or functional medicine approach, is that typically they're saying, oh, just put steroids on your skin. But that's not treating the cause, that's treating the symptom of the eczema and the itching. And we know long-term steroids is not great for kids either. And so when we address the cause, which is usually gut health, then kids get better. And so we see a lot of eczema in our practice because we can treat it really well and kids improve.
So without testing for it, if you have a parent that's got a kid that's got like rough skin, eczema, whatever, like what are some of the main things you tell them to do? Even if like you didn't know what was going on in their gut, you just kind of assume that there's something going on. What would you advise a parent to start with?
Yep. So some of it, we look at diet. So we know there are a few foods that are more likely to contribute to eczema. The ones being dairy, eggs, and gluten. And then sometimes nuts can also be that for a number of kids. And so you can do trial eliminations of those foods. So when you take them out at least for ideally at least 6 to 8 weeks. And then you see, and when you take them out, you ideally have to like really, really fully take them out, because if you do it a little bit, you can't really tell. And then in terms of improving gut health, things like probiotics, omega-3 fatty acids, which are really anti-inflammatory. So those can be really helpful for the skin. Vitamin D. So a lot of kids with eczema tend to be low in vitamin D. And then zinc has also been shown to be to improve eczema as well. So sometimes we'll just start with basic things. A lot of it is diet, and we're looking at, and we talk about, okay, well, how are their bowel movements? Because that tells us a lot about how their gut health is. So, and then do we need to do remove foods? And then are there things that we can do to support from an anti-inflammatory, support gut health? And a lot of times just doing some of those simple things actually can make a huge difference.
Yeah. So the main, sounds like the main inflammatory foods that tend to get flagged, like you said, it's going to be dairy, eggs, gluten, and you said some nuts. Yeah. Could do that. Food elimination, obviously probably good to start, and then maybe reintroduce over time. Yeah. I think I read that the gut lining regenerates itself like every 3 days or something like that. It's short. So like it actually like repairs itself pretty quick. But if you have chronic gut issues, it could take some time to heal your gut. So when you say like we need to restore the gut, how long do you typically see that it takes to like once you've removed those foods that are inflammatory to a kid, how long does it take for the gut to really like heal and restore itself?
It honestly really depends on the child, but that's why I say usually a minimum of 4 weeks, ideally 6 weeks of taking the food out, really doing the probiotics and the fish oil, really doing all of that really consistently. And then the goal is to try to get those foods back into the diet. However, we may notice that over time, if you start to introduce that food and you're saying, okay, well, they seem to be okay with it, but you start to do more and more of that food and then they start to flare again. Well, then you know that food at higher levels, they can't do that. They can have small amounts of it, but they can't have large amounts of it or it will trigger the eczema. So you have to play a little bit with that. But the goal is to not have a child on a restrictive diet for a long period of time. The goal is to really identify and heal the gut. And so for instance, if you've taken food out and you've done what you feel like is gut healing and you introduce the food and it's still bad, or you've taken out the foods and you've done all it and it's still not better, that's when definitely you probably want to do some more testing. And really there's food sensitivity testing and do more gut health testing because something else may be going on that you're missing with just the basics.
Yeah. And this kind of leads me while we're on like kind of dermatology type stuff. kind of leads me to asking about sunscreen. So a lot of
Mm-hmm.
parents, this has been also one of these things that's popped up. A lot of influencers are talking about all the toxins that are in sunscreen, and they've shown people that put sunscreen on and they show them under certain lights
Uh-huh.
where it like looks like a tar that was like placed over them because
Uh-huh.
of all the stuff that's in sunscreen.
Uh-huh.
And I can tell you for myself, as I've gotten older, traditional sunscreens irritate my skin.
Yeah.
So I'm just curious, like, what are your opinions on sunscreen?
Uh-huh.
Obviously, like, we need to protect our kids' skin and we don't want them to burn.
Right.
But are there any like types of sunscreen that you would tell parents to get? And just any guidance around, I guess, the use of sunscreen, because I do see that being an irritant for a lot of people, including kids.
Yep.
So just trying to navigate that, especially as it's, starting to get hot outside.
Of course,
So,
yes.
yeah.
Yes, we have to talk about sunscreen here in Arizona a lot. But really, when I'm looking at sunscreen for kids, I'm really telling parents we want a non-chemical based sunscreen. So usually that's going to be something with zinc oxide in there. That's, the white, pasty, thick. Yes, it's thicker. Yes, it's harder to rub in, but that is going to be the best option. That's going to be protective and it does not have chemicals. I often also have you heard of the Environmental Working Group and their website? So the Environmental Working Group's a nonprofit organization and they have a lot of like healthy living guides. They also come out every summer with a sunscreen guide and they list the top sunscreens they recommend and the ones that they don't recommend. And then they rate them all and they rate them on a scale and you can actually go in and look at all the chemicals and how they rate in terms of, is it an endocrine disruptor? Could it cause reproductive harm? Is it an allergen? And so I often refer parents to that website. They also have a whole database called Skin Deep, which you can search any cosmetic, whether it's body lotion, soap, makeup, any skincare product, including the sunscreens. And they have a whole section on babies. And you can actually search products and see how they rate. And they rate them 1 to 10, and 10 higher to 10 is obviously they don't recommend because they have a lot of chemicals, but then they'll actually explain like what chemicals they have and why this is a concern. So that is really helpful for parents to actually see, because then I would say, go type in what you have at home and see how it rates. And they're surprised to see like how many chemicals are actually in there. So that's and I usually have a sunscreen guide every single year. So that they're similar each year. But I usually refer parents to that guide to kind of help choose which sunscreen to use for their child.
I've seen some people looking at making their own. I guess they like beef tallow and like zinc oxide, just mixing the two together. Is it that simple to block the sun just with zinc oxide?
I mean, zinc oxide will definitely block the sun. I think I've heard of some people just using the tallow by itself, and I wouldn't do that because we don't have a lot of research that's going to show that that's actually going to be protective. But we know that zinc oxide actually but I don't know. I haven't.
Well, I'll look that up
those,
and I'll add that link to this episode as well in case people want to look that up, because that's really good. With sunscreens, would it be safe to say that anything that you can spray out of an aerosol can is probably not a good sunscreen?
Yes. Ideally, the spray, yes, they're easy, but
yes.
No.
I'm happy you said that because I hate it. I hate trying to apply it to a kid and you're like spraying it and it's just going it's just the wind is carrying it somewhere. I'm like, this isn't even doing anything. All right.
Yeah, most of those have their chemicals, and just by the nature of it being an aerosol, that it just doesn't. But I struggle. My daughter hates putting sunscreen on, so we struggle every single summer. She's, doesn't like how it feels, and so it's hard. But you want to try to get as much as you can. And there are sometimes you have to try different ones because some actually rub in better than other ones. And there are some that are like sticks that work a little bit better. And so that's easier sometimes for kids to use and they can do it themselves as opposed to like the lotion that they have to rub into their skin.
Yeah. Yeah. How about teenagers and hormonal acne? A lot of, there's been like Accutane and all these other ways to like try to help manage it, but are there certain like guidelines that you would give to someone to naturally try to minimize that inflammatory response in a kid and how to deal with that? Because it's tough. Some kids, they get really, really bad acne, and I know it's probably socially difficult. They probably get embarrassed and they get insecure. So, anything that you can do to reduce that. But what tips would you have for parents that are trying to help their teenager navigate those acne flare-ups?
Yeah. So acne is a gut issue. So it all comes back to the gut. And usually when you talk to these kids and these parents, they don't have a great diet, their bowel movements aren't great. We can kind of correlate it back to gut. And so we start with the gut. We really work on improving gut health. So sometimes that's with probiotics, and then doing the right dose, again, omega-3 fatty acids, because they're anti-inflammatory. There are topicals. So there are a lot of different compounded topicals that we'll do that are, certain vitamin-based that actually really help. But those are just going to be topical, fixing the view of your face, not fixing the cause. You have to address the gut. And a lot of times there's foods is a huge reason for acne too, dairy being the biggest one. So dairy and sugar are the big ones. So sometimes, and we know teenagers sometimes go crazy with the sugar and the sugary drinks. And sometimes just taking those alone, just taking them out of their diet will improve their skin significantly.
I mean, you say dairy and sugar, and the first thing that comes to mind is cereal. And every teenage boy, at least, I can't speak for the teenage girls, but most teenage boys grow up on that stuff.
Mm-hmm.
I know I did. We'd go home to my parents' house for lunch in high school sometimes, and we'd knock down 3 bowls of cereal for lunch. Like, it was just easy and it's fast and we loved it. But those two combinations, along with the hormonal changes, are probably wreaking havoc on kids' faces and backs and all that. So that's good to know. It is interesting how much comes back to the gut. I'm learning way more about that, even to the point of like healing and tissue repair and like injury repair. Like, it all starts in your gut. So like, if you've got kids or adults or whoever that have injuries they're trying to repair from, or a torn this or a strained that, if your gut health is bad, it's not going to send the response to repair that, right? So it's like so much just happens in the gut, which is really, really interesting. So all right, I love that. I think we hit a lot of really awesome topics there. I'm curious to maybe dive into obesity. We've talked a lot about gut health. We've talked a lot about chronic illness, but it seems that obesity is just becoming such a major issue, not just in adults, but in children. Like I said, they're starting to classify it now. The child age is now 2 to 19. And in the US, it's 20% are obese, not overweight. That's the extreme. I mean, that's just for those that don't know. That's obese, and that's really high. And that rate has tripled in the last 30 years. And I think it's only expected to get worse. I think I read another statistic from Forbes or Fortune, one of the two, that they are estimating that 50% of the world population will be obese by the year 2050. So what do we do?
I mean, well, talking about the foundational, why is this happening? So a lot of that comes down to, what are these kids eating? And that's the unfortunate thing, is that processed foods are so rampant in the United States. Like, people eat so many processed foods, fast food, easy access, and it's inexpensive. So very easy for people to eat. And then we talk about the sugary drinks. Like, that's huge. So many kids are drinking juice. They don't drink water, they drink juice, or they're drinking sodas. I mean, there's kids that are young and drinking soda, which is alarming, but people just don't know. And that's the biggest problem. It's the educational piece. And then this comes down to the generational piece too, because kids learn from their parents. And so if the parents don't have the education on how to eat healthy or what healthy is, then they're not going to pass that down to their kids. And then that cycle just keeps repeating. So we have to do something. We have to do something to stop this from happening, because it's alarming and it's scary. And there's so many other health issues that come along with obesity, that these children, their life expectancy is going to be shorter because they're obese at age 4 and 5. And that never used to be a problem. So a huge part of it is the foods that they're exposed to and the sedentary lifestyle. So kids aren't moving like they used to be. A lot of schools don't have physical education anymore as part of it. And kids are sitting in front of screens. They don't go outside. They don't play. which was what we all used to do when we were kids. We always had to be outside, and that's just not a typical thing now. And part of it, again, I don't think people understand the need for children to get out and move their bodies and how important that actually is. And so, part of it, I think, is going to start with education. And education, especially in areas, it's a lot maybe of the lower income families that they don't have the education, and then they don't know, they think, oh, well, it's too expensive to eat healthy. But we could educate them on, here are ways that it's not too expensive to eat healthy, and you're actually getting the nutrition that you need, as opposed to the processed foods, which are just really high in fat and sugar and calories, but have no nutrition in them. So it's an alarming, that is, a lot of the colleagues that I have, that are in pediatrics, we are very, very passionate about how do we keep children healthier? How do we really make a difference in children's lives and really stop this from happening? And so we're getting there, but it comes down to the basics of providing just basic education on that.
Yeah, this one's tough because it's kind of like, I am so far from being a perfect parent on giving my kids food. Sure. If I had them in here and my kids were telling you what they ate, you'd look at me and just be like, really? No. Even though we're pretty dang healthy. Yeah. And so it's tough because there's a fine line between, trying to just take care of your kids, keep food on the table, mm-hmm. but also slowly killing them. As parents, it's a harsh thing to say, right? But at the same time, if these chronic illness diseases that tend to be gut insulin resistant issues mm-hmm. are skyrocketing, how much blame can we even put on the kids? It's really, you got to look at the parent. Mm-hmm. And like what you said, there's some educational issues there too. And there's not not everyone is educated the same way. I get that, but man, it's tough. You see some kids that are really big mm-hmm. and it's kind of at what point do the parents kind of take a look in the mirror and say, well, I need to do something different for my right. kid. Because, like what you said, the number one killer in America is heart disease. Mm-hmm. And so over time, if they are, obese and obesity rates are going up, heart disease is going to go up, life expectancy is going to go down as it has in the United States, which is shocking. Mm-hmm. So we've got to do something as parents. And you mentioned processed foods, but even to further that, it's ultra processed foods. Sure. Because there's a lot of processed foods True. That could be at least okay. Right. Yes. And then you got the ultra processed yes. foods, which are just bonkers. When right. you look at what's in that crap, mm-hmm. it's so bad. Mm-hmm. And it isn't sometimes until the kids are eating it that I'll look at the package and I'm thinking, why did we buy this? This mm-hmm. is insane that what's in here. And then, my wife and I will have a conversation. We're just let's not buy these again. Yeah. Right. And so it sucks that there's just so many cheap options to eat and they're just empty calories with mm-hmm. just sugar and mm-hmm. starches and super inflammatory additives and all that crap. So this is a tough one. And this is one I'm super passionate about. And, for really active kids, they can kind of maybe offset some of the mm-hmm. crappy diet. Mm-hmm. They're still going to have the skin issues. Mm-hmm. They're still going to have all those mm-hmm. other issues. You can't escape that. They might be able to escape obesity for a time, but we're not doing them any favors by having them eat like this. And it doesn't, to your point, it doesn't have to be expensive to eat healthy. No. It feels like it sometimes. Yeah. If I go out and I try to have a healthy meal or go get one of these pre-prepped, sure. macro meals, they're $17 for lunch. That's not great. So we've got to do better as a society. I think a lot of the issues we're seeing with kids, like what you said, it's almost like societal issues mm-hmm. where it's just become normal for kids to sit in front of a screen for 8 hours in a day and play with their friends. Their friends are doing it. Yep. So that's normal. Right. It's normal to get home late and, from soccer practice or whatever it is, that's becoming way more normal. Mm-hmm. It's normal to just order some crappy food and throw it on the table because we're all in such a hurry. Right. That's become society, accepted in our culture. And so there's just all these cultural norms that we really need to start to challenge a little bit. Mm-hmm. Otherwise, these numbers are going to get staggering and it's pretty scary. So, mm-hmm. This podcast is all about generationally like how we can help our kids, help the kids that you see. And that's what's so great about what you do. And I'm kind of similar. Like I love working with kids and I love seeing kids grow and develop and all that kind of stuff. Maybe more in like a sports setting for me, less medical, but just curious, what does building generational health mean to you?
I mean, it's really teaching future generations how to be healthy, talking about the basics of what does that mean. And this goes even to, and I think about this with my own daughter. Like she sees all these other kids eating this junk food and she wants to, and I just try to explain to her what that means and why it's important and how we want, our kids to be healthy. And and that's a big part of what I do. I mean, most of my work, yes, the kids are my patients, but I'm really educating the parents. I'm working with the parents so that they can take what they learn and then pass it on to their kids. And then that will continue to get passed on because we need to make a huge shift in our society. It's not looking good for our kids right now. And it's really scary, to be honest. And so, my goal is to really educate parents as much as I can so that they can then pass all of that information on to their kids. And then hopefully as time goes on, we figure out as a society how to be healthier and keep people healthier. Yeah.
Kids are watching for sure.
Kids
they see
pay
everything
attention
we do.
to everything.
They're watching if we're eating well, the way we
100%.
eat, if we exercise, how we treat each other, how we talk to each other, all that kind of stuff. Kids pick it up. So no, I appreciate you coming on here and sharing your knowledge with us. Like I told you earlier, I said I had all these stuff. I think we went through two of them and sort of branched a little bit. So I could talk about all this stuff. There's just so much to learn, but appreciate you sharing some of your knowledge with us. Maybe really quick, and I'll add a link to this too, but maybe tell us the name of your practice, where people could find you if they're here locally and want to reach out. And either your website or
So our practice is called Natural Kid Doc. We are located in Central Scottsdale, Shea in the 101 area. We have people travel all over the valley. And our website is naturalkiddoc.com. And we are also on Facebook and Instagram too.
Very good. All right. Well, thanks so much for coming in. Really appreciate your time. And it was a really good discussion.
Yes. Thank you so much.
Thank you.